which is where he joins us live from this morning. Can I assume health care was one of the most talked about topics there?
It was. People are upset. People who have pre-existing conditions are concerned that they may lose their insurance as states have the option now of opting out.
Will you be taking anything from the House bill, or will you be starting from scratch as the Senate crafts its measure?
Well, the Senate has to consider this as well. My concern is that the Senate may pass something slightly less awful, but I hope that reasonable voices in the Senate will prevail. I mean, this bill would leave 24 million without insurance. It would take away insurance from people with pre-existing conditions, and it would increase premiums. So in good conscience, I don't see how people in the Senate can support it.
And real quick, would you approve anything other than single-payer health care?
I mean, I think single-payer health care is the best solution, and Donald Trump himself has said that in recognizing Canada and Australia as the better solutions. But of course, I'm open to making the Affordable Care Act better. One thing we could do is add a public option to the Affordable Care Act. The ideal is a single payer, but those of us in the House have said we will work to make the Affordable Care Act better. We just haven't seen a partner on the other side.
Congressman, one could argue that the reason it passed the House was because of all the California Republicans who voted in favor of the bill. At any point, did you have conversations with your colleagues here in the state of California, your Republican colleagues, and try to convince them to do otherwise?
Well, I've had colleagues with Republicans in Congress. I don't want to get into the names of the private conversations, but I'll say this. There were a lot of Republicans who had concerns about this bill, and then you had Vice President Mike Pence camped out on Capitol Hill every day, I could see, with his security entourage. And they were really putting a lot of pressure on these lawmakers. And there were lawmakers who I thought were going to go vote no based on conversations I had. And then you got to the House floor and you saw them voting for this bill. So I think leadership and Vice President Pence and others really cracked down to try to get this bill through.
And we could be months away from the Senate version. How do you keep, there were a lot of, Nancy Pelosi, for example, very fired up about the vote in the House. How do you keep that momentum or that passion going if it's to be spread out over a number of months?
Well, I don't think it's for us politicians to keep the momentum going. I think as people find out what's in this bill, they're going to speak up. I mean, if you have asthma and now may not be able to get insurance at a reasonable cost, or if you have cancer, God forbid, and can't get insurance at a reasonable cost, this is going to affect people's lives. And as we hear their stories, I think the compassion and decency of this country will prevail, and they're not going to ratify a bill that deprives so many people of health care.
Before we let you go, Congressman, just kind of switching gears, wanted to ask you whether or not you agree with President Trump's use of that Moab bomb in Afghanistan.
Well, I did not, because I don't see what strategic objective it serves. We've been in Afghanistan for over 15 years. We still don't have control over the area. The Afghan government has about 60% control. 40% is controlled by groups related to Pakistan, and there is no strategy there. So just having a bigger bomb is not going to solve the structural issue. And my question is, why are we still there, and how does that serve the United States strategic interests?
All right, Congressman Khanna, thank you for joining us. When you are back at home, I'm sure you'll continue to get an earful from your constituents.
Thank you, Congressman.
I appreciate it. Thank you very much.
Thank you.
All right, let's check in with Sal Castaneda and that Monday morning commute. Sal, I never got a chance to say I hope you had a great weekend.